Welcome to Healthcare Entrepreneur Academy, where we seek to educate, motivate, and inspire professionals into starting their own healthcare businesses. Learn from leading healthcare entrepreneurs and other business experts as they share their journey and provide a glimpse into their playbooks for success. Loaded with valuable insights and actionable strategies, this show will guide you on your path to freedom. Now, please welcome your host, entrepreneur, healthcare practitioner, and MBA, Jason Duprat.
This episode is sponsored by my free presentation for the Ketamine Academy. If you're tired of long hours, constantly being on call, or having to give up your nights, weekends, and holidays, all for an employer that only thinks of you as a productivity number that they're trying to maximize, then it's time to break free from the hospital grind, become your own boss, and finally take control of your professional trajectory. It's time you start your own practice. I know it sounds really scary, maybe even a little impossible. I get it. You got student loans, you're working tons of hours, and you may not even be a physician. Well, I am here to tell you that it's absolutely possible. Starting my own clinic was exactly how I started my healthcare entrepreneur career. And there's one specific type of clinic that almost anybody can open. Ketamine therapy is one of the most promising treatments in the fight against depression, PTSD, and chronic pain that we've ever seen. And thousands of patients across the country are looking for clinics in their area. The problem is that there aren't enough yet. And these patients need someone like you to open a ketamine practice in your hometown. Go to ketamineacademy.com/presentation for a no-cost 60-minute training on how to gain more freedom by opening up your own clinic. On the presentation, you'll discover why opening your own private clinic is a better decision than working more overtime or going back to school for another degree, why this one specific niche clinic is the easiest to open and doesn't require a bunch of cash to start, and how anyone can open this type of clinic, even if you're not a physician, by just following a few simple steps. So to register for this free training, just go to ketamineacademy.com/presentation. Hey, what's going on, everybody, and welcome back to the Healthcare Entrepreneur Academy podcast. I'm your host, Jason Duprat, and we are back here for another Tactical Tuesday. And there's a lot going on in the markets. There's a lot going on in the business world, in the healthcare world. It's an interesting time to be alive, that's for sure. We have a period of rapid stock market declines. We have coronavirus spreading at rapid rates. Well, part of that's probably just due to increased testing. So the numbers have skyrocketed in the last few days. And it's interesting to see how things are going to play out. Obviously, just like every great problem this nation has faced, although this is an unprecedented one, the closest thing that we've seen to this was the Spanish flu back in 1917, 1918. But just like every other time, we're going to get through it. Things will return to their normal. It's just a matter of when. And all the great experts are proclaiming to be fortune tellers and predictors of the future and predicting the exact date. I don't believe in any of that, and I don't claim to be the predictor of the future, other than to say that we will get through this. Is very obvious. We have always gotten through everything. But as far as timeline, who knows? Who knows? We have no idea. Hopefully the quarantines that are in place are going to impact the spread and drastically reduce it, which I think it will if people do their part and stay indoors. But just today, when I logged in to check the stock market's down again, another several hundred points. And this was recorded just for reference, because I record these a little bit early before they actually release. So I'm recording this on March 23rd. And as of today, the stock market opened about 4% down. So it's in the 18,000s and seems to be slowly coming up throughout the day. Well, less negative anyways. And but you want to keep in mind that the stock market is just a measure of perception. It's a measure of public sentiment. It's a measure of fear, and it's a measure of greed. And so watching the stock markets is just that. It doesn't really tell you exactly what the stock market is doing. It's everybody who is anticipating and trying to predict based on today's information what might happen weeks down the road. And when it's high, people are obviously going to jump ship quick because they want to capture those wins. And it's probably what we saw when the market came down pretty quickly. Everybody trying to capture those wins. But it's really important to keep in mind that, stock markets don't mean everything. It's just a snapshot of what the public emotions are doing. Stock market is highly driven by emotions. And, we're definitely we entered a bear market. The definition of a bear market is when the stock market drops 20%. We've reached that. Typically in past and throughout history, a bear market or a recession rather will last several months. Typically, on average, it's usually like 6 to 9 months, and then things start to turn around. Who knows? With this one, it could be a lot faster. Trump is saying it's going to be super quick as soon as the infection rate goes down and things start to resume. The economy is going to boom right back up. We've got Congress right now negotiating a massive stimulus package, something that's completely unprecedented as well. This time, rather than waiting for everything to fall apart, it looks like the government is actually trying to take some preemptive action. And so if that gets passed, just might turn around much faster than it normally would have. But just to give you guys a little insight as far as like what a recession is, by definition, the recession is GDP that drops for 2 quarters in a row. And so are we in a recession? No, because this hasn't been going on for longer than 2 quarters. But we are definitely in a bear market because the market has dropped more than 20%. But this is a period to like not look down, or to not be down, to not feel down. This is actually when there's crazy times like this, when there's people are panicking, this is the time when the wealthiest people in America take advantage, or the future wealthiest people, I should say. If you look back at history and you study other recessions or other depressions or other major downturns in the economy, some of the strongest companies have been started right during those times. And the benefit of a recession or a depression is that it weeds out so many weak companies, and it thins out and eliminates, businesses who weren't serving their customers well, businesses who didn't manage cash flow well, and it creates a massive amount of opportunities. Things were very oversaturated. Almost every industry seemed to be overinflated. We were definitely in a bubble, and things have corrected and then beyond. And so you're going to start seeing, there's going to be a delayed effect for sure, but you are going to see businesses go under for sure. Not trying to predict the future or anything like that, but it's throughout history, it's shown that businesses will go out of business and opportunities are 100% created. And so the key thing that you should be doing now is figuring out what angle you are going to take to make the most out of this situation. And so things are still dropping. And so I would say it's probably not a good time to be acquiring businesses or making, aggressive moves until we start to see how this is going to play out. But what you can do is prepare. Just like I mentioned in the previous Tactical Tuesday, is get your education on. Start to look at what is going on in different markets. Fortunately, the healthcare market is one that's going to be barely touched in most areas. You see some, elective cases getting canceled and, a lot of outpatient stuff just because the supplies are limited. But I think that's going to be really short-lived as these supplies start to increase. And as a whole, the healthcare industry is quite safe. And if you're starting or growing or thinking about serving somebody in the healthcare space or starting a healthcare business, this could be a great time to do that. Sure, are we going to lose some healthcare businesses too? Yeah, absolutely. There's bad businesses out there in every industry, and some of them are going to get hit hard. Some of those businesses who are dependent on elective cases or non-essential type cases, who didn't have enough in savings, they didn't have emergency funds, they didn't manage their cash flow very well. You might lose some of those too. And good news is that opportunities are arising out of this. It's going to be a little bit of a delayed effect, I think, because, the government is obviously stepping in and trying to help small businesses with loans, trying to help the general public with these checks that may or may not be coming out. So I think there's going to be a delayed effect, especially in the real estate market, because they've put a temporary moratorium on foreclosures. And so you won't see anything immediate as far as drastic price reductions for real estate or anything like that, or a massive influx of foreclosures. That's going to be many months down the road, if and when we see that. So if you're a business owner now, or potentially interested in becoming a business owner, start preparing yourself by educating on how you can best leverage this opportunity that's right in front of us. And there's going to be some winners and some losers. And hopefully, if you're prepared and you're educated, you're going to be on the winning end of this. Now, if you have a business today, while things are looking pretty bleak in a lot of areas, depending what sector that business is in, you're going to need to strategically make some changes. If you're in the healthcare industry, if you're a staffing company, things are probably looking okay for you right now. If you're doing elective cases, things are probably looking possibly pretty grim in the short run, but hopefully you've had a substantial amount of cash reserves to get through this time. This is why good financial management is key to not only your personal success and security, but your business's success and security. And so just because a lot of business owners, unfortunately, do a terrible job at managing not only their own personal finances, but their business's finances, they're gonna go under because they don't have enough cash. So what you can do in anticipation of possibly being affected by this, as this continues to get longer and longer as a business owner, is to focus on your cash flow. Businesses don't go out, they don't go under typically for any other reason than they just don't have enough cash. And so cash is typically found in three sort of areas, and that is accounts receivable, accounts payable, and in inventory. And so if you're finding yourself cash strapped, if you've already gone through, or if you didn't have enough emergency funds, you have to fix your cash flow. And the best way to do that is to look at those three areas: accounts receivable, accounts payable, and inventory. And so if you have accounts receivable, you need to capture that revenue as quick as possible, because if somebody owes you money, or somebody owes your business money, you need to get that cash. That's a great source of easy revenue, easy cash flow, is to collect on your accounts receivable. And sometimes that might mean negotiating. And so if you have an account receivable that's, maybe owes you $10,000, you might start putting a little pressure on them, start offering them a discount on that cash receivable. So that way you can collect and have more cash flow, more cash reserves during this downtime. You want to really start negotiating and start putting pressure on anybody who owes your business any amount of money. These are vital times, and you may have to obviously negotiate and take a little bit of a hit on your own, but you want to capitalize on those cash receivables or accounts receivables as much as you possibly can. Next, you want to look at your payables. In every single angle, your business is going to have some payables in every direction, including the government. So the government is offering tax deferrals right now. I think they put it out till June, if I recall correctly. But tax returns aren't due until June. And so if you're going to get an interest-free, basically loan from the government to not have to pay your taxes, or being able to defer your taxes with no interest or penalties, that's essentially you're getting a loan for several months. So I would take advantage of any tax deferrals that you may have. Some people think, oh, it's my obligation. I'm a U.S. citizen. It's my obligation to pay in as much taxes as possible right now because the government needs money. Government needs revenue. And while I certainly can respect that argument, the government has unlimited ability to do what's called quantitative easing, which is buying back bonds and essentially printing money to buy back bonds. And so the government is not hurting for money. They can print unlimited quantities of it. And if they're going to give you whatever it turns out to be, 60, 90, 180 day deferral on taxes, that's a great way to keep some extra cash in your pocket. Also, you want to look at different grants from the government and finding and sourcing individuals who know how to get those grants. Those don't usually just dry up overnight. There's new grants from things like Facebook. They've offered $100 million in Facebook ad spend and other types of grants to small businesses. So that could be something you look into to essentially reduce your outflow of cash in your business. You also can look at the different small business loans. The government's supposed to be putting together a package for very easily obtainable, low interest loans for small businesses to essentially get them through this, whatever the next couple of weeks or months or whatever it turns out to be. And so you definitely want to look at your accounts payables, all of your outgoing cash flow, and see what can be cut, what can be deferred. Obviously, you have an obligation to your employees, and so you don't really just want to go start cutting your staff. You want to hold on to them as much as possible, the good ones especially. And if you start cutting staff too quick, you're going to potentially set a culture of fear. And so you really want to hold on to your staff as long as you possibly can and keep that payable for as long as realistically possible. Next, you want to look at your inventory. So you don't want to hold on to, if you're a physical products business, you don't want to hold on to tons of expensive inventory or slow moving items. You want to start to offload those through discounts, through promotions. And maybe if you have an expensive product that you're selling, instead of holding on to that in your own warehouse, maybe you have the manufacturer drop ship that directly to a customer rather than having to pay, storage fees and holding on to essentially tying up cash in inventory. So you want to get lean. You want to only keep the most essential pieces of inventory on hand. The rest you need to offload, so that way you can free up some cash. Essentially, inventory is cash sitting in a warehouse. If you have a $10,000 piece of machinery that you could sell, that's $10,000 worth of cash that's sitting there in a warehouse, not getting interest, not usable. It's completely tied up. So inventory is a great thing to look at if you have a physical products business. You can also, during these times, like I said, opportunities are abound, and the recession, any downturn in the economy, whatever you want to call it, it's not a recession yet, but a bear market thins out the competition, and you don't want to be part of that thinning in any other way than you being able to essentially use it to your advantage. And so what you will find is, as these businesses start to go out of business or start to lay off employees, this is potentially a great opportunity to pick up some key assets of your competition. And so as they're laying off employees, this is the time to start looking around, to start networking, to see who you could possibly acquire as a key employee as soon as the timing is right. So you can not only pick up their employees that they're getting rid of, you can also pick up their customers. As customers start to drop off, as they go out of business, there's going to be a slew of new customers who need services or products. And so you can be ready to do that. And another opportunity is to find struggling businesses and help them. Use your skill set. Do you have a lot of management experience? Do you have HR experience? Do you have grant writing experience? Do you have marketing experience that you can use to help a struggling business in exchange for equity? And so as things get worse, and they probably will over the next few weeks, you will want to be keeping your eyes out for these types of opportunities. Businesses, like I said, are going to fail. Businesses are going to go for sale. Businesses are going to go for sale for cheap. You're going to have probably a lot of baby boomers at the end of all of this who still own businesses. They still own the majority of small businesses, and many of them don't have like a solid exit plan in place, but many of them may just be kind of over it when this whole period washes up, and they might be willing to exit their company for less than what they would normally take after having gone through another downturn. They clearly, if they've made it, they've been in business for any period of time, they've already suffered many downturns and they've survived them. And, you can use that as well to your advantage, your strategic advantage. Business owners are going to be selling probably at a discount. And if there's still good fundamentals in a business, there's a good chance that you might be able to, capitalize on that down the road. Obviously, like I said, it's going to take a while, but the idea is to get the thought process flowing. How would you structure this? Who do you know who you might be able to help out in these downtimes in exchange for equity? What business might be going out of business where you could scoop up their customers or their employees? If not now, then as soon as things start to turn around. So all these ideas you want to start to be thinking about and figuring out how you can use them in a way that's going to not only help you and your business, but to help out the employees of these companies that you're buying or the customers who need products or services. So it's not all about you, obviously. It's, as a business owner, you have a lot of responsibilities. You're providing jobs, you're providing services, you're helping the economy. And so when I'm talking about taking advantage of the situation, you're taking advantage, sure, from a business strategy perspective, but you're actually, as a business owner, you're doing a great deal of good. You're not like taking advantage like in a negative way. I'm talking about strategy. So hopefully you guys are smart and you pick up on that distinction. A couple of other points that I wanted to make right now is, so I wanted to obviously this is going to take a while, and it might take quite a while. We really don't know because we don't know what's happening with the stimulus package. We don't know how much money is going to be dumped into the economy in the form of quantitative easing and all these other programs that are about to be voted on or maybe approved. But right now, we have an economy that's completely going to be propped up on essentially what's drugs. So you have essentially, it's for lack of a better analogy, you have basically the economy is a dead body that has a functioning brainstem, and it's all this extra stimulus is keeping that brainstem alive for the time being, and we don't really know what the economic consequences of that are going to be, or how long it's going to delay things, because it's certainly going to delay things, especially if the government's giving all this extra income to small businesses, to families, putting a moratorium on foreclosures. Things are certainly going to be delayed. And so this is an really interesting time. And you have to, instead of getting burying your head in the sand and getting all down and sitting here, wasting your time thinking about conspiracy theories or getting trapped in this clickbaity headline stuff, that's not what you should be doing right now. You should really be you should be letting go of the things that you can't change. Obviously, there's a lot going on externally that we can't change. You can work on what's going on internally. And in order to do that, you have to first accept that there's a lot of stuff going on externally that you have no impact, you have no control over. So just don't even worry about it. Stop thinking about it and don't get consumed in all this conspiracy theory nonsense, fancy headlines, news feeds that become traps, and social media and all this other stuff. You have to stay active. You have to be an active participant. You have to keep moving forward. You have to keep taking action. And there's actually an old saying that goes something like, if you're standing in a pile of crap and not moving, you're going to sink. So you have to keep moving. You have to keep going forward and putting your focus on the things that you do have control of, which is obviously you lose a lot of control of the external environment, but what's going on internally, your mindset, what you're doing to prepare to leverage any sort of downtime or down economy to your business's strategic advantage. That's what you want to be doing right now. And anyways, guys, if you guys are not a part of our Facebook group, you can find it by going to Facebook, look in the search bar, type in Healthcare Entrepreneur Academy, and it will show up right there as a group. Just request to join that group there, and lots of conversations going on in there. Hopefully, as we get more members, we'll get more conversations. I broadcast all the Facebook live interviews right to that group, so you get first look behind the scenes access. We record several weeks ahead of schedule. Sometimes we're months ahead of schedule. So if you want to get the latest up-to-date, most recent information, you want to catch the lives, because if you're not catching the lives, you're at least probably 4 weeks behind recording. And as we start to talk a little bit more about the economy in some of these podcasts, the COVID crisis, the pandemic, and everything that's related to current events, and you want to stay up to date on that, the best way to do that is to do that in the live, by watching the lives in the Healthcare Entrepreneur Academy Facebook group. But anyways, guys, I hope you enjoyed this episode. Keep your head out of the sand. You don't want to bury your head in the sand. Keep learning, keep preparing, and we will see you guys on the next episode. Talk to you later.
We hope you enjoyed this episode of the Healthcare Entrepreneur Academy. Want to connect with more like-minded healthcare entrepreneurs and professionals? Just head over to jasonduprat.com/group to join our Facebook family for real-time interactions, insight, and resources to get you one step closer to realizing your goal. We look forward to interacting with you, but until then, we'll catch you on the next episode of the Healthcare Entrepreneur Academy.